Properly implemented, family planning is a public health miracle capable of averting nearly 30% of maternal deaths worldwide. Yet in Pakistan, the total fertility rate remains stalled at 3.8. Across the country, 20% of couples have an unmet need for contraception, despite their desire to space or limit births. The friction happens almost immediately. 37% of Pakistani women abandon contraceptives within a single year of starting them. The primary reasons they cite are health concerns and deep dissatisfaction with the care they received. Physical access to a clinic means very little if the patient walks out the door and refuses to return. To find out why the system is failing these women, we can look at a recent study by researchers Shamsi, Sultan, and Fazal. They surveyed 600 married women across 6 private family planning clinics in Karachi. They didn't rely on follow-up calls weeks later. They conducted client exit interviews, capturing raw, unfiltered satisfaction data in the parking lot immediately after the women finished their appointments. Their hypothesis was clear. The actual quality of care provided by the clinic, rather than mere geographical convenience, dictates whether a woman will continue to use these services. The 6 clinics chosen for the study serve vastly different neighborhoods across Karachi's massive urban sprawl. On one end is the DHA clinic. It represents the apex of privilege. 100% of its clients hold at least a secondary education, and they fall entirely within the city's richest wealth quintile. Compare that to the Korangi clinic. It serves the study's most vulnerable demographic, containing the highest concentration of patients with 0 formal education and those falling into the poorest economic categories. These 2 clinics sit at absolute opposite ends of Karachi's socioeconomic spectrum. What happens inside reveals a massive divergence in healthcare delivery. Across the entire city, the most common contraceptive choices were IUDs at 31%, followed by implants at 26.7%. At DHA, 100% received a single method, implants. Watch the chart shift to Korangi's data. It fragments, short-term injectables at 48.5%, implants at 26%, IUDs at 15.2%, and 0 condoms. These extreme variances across zip codes indicate that local provider biases and unequal counseling dictate medical treatments just as much as individual patient choice. At first glance, the baseline satisfaction data looks great. Nearly 89% of all surveyed clients rated their satisfaction highly, scoring between 8 and 10. Here is an 11-point satisfaction scale. At DHA, every single patient rated their experience a perfect 10. Watch the scale shift to Korangi. The scores scatter widely, dropping down the board into 7s and dipping to a 4. Using Kruskal-Wallis testing, the researchers generated p-values confirming that these differences are statistically significant. DHA's flawless record is a measurable outlier, while Korangi suffers from critical inconsistencies in the service it delivers. The data proves a harsh reality. In Karachi's private health sector, a woman's zip code and wealth directly dictate the quality of care she receives. In reproductive healthcare, satisfaction serves as a clinical proxy for method continuation. A low satisfaction score in a place like Korangi translates directly to a higher probability of patient dropout, unintended pregnancy, and increased maternal risk. Providing inconsistent, substandard counseling in low-income neighborhoods actively sabotages the entire nation's reproductive health goals. Overall, the private sector is doing commendable work by absorbing the high demand for family planning. But the geographical disparities within that system cannot be ignored. Clinics like DHA shouldn't be treated as wealthy exceptions. They need to be utilized as the baseline blueprint for nationwide provider training and patient counseling. Facilities in lower-income areas like Korangi urgently need targeted interventions and rigorous, continuous quality monitoring to close this gap. Pakistan must stop measuring public health success purely by the number of clinic doors opened and start measuring it by the uniform quality of care provided behind them.